Dr. Angela Stengler, here with Dr. Mark Stengler. We are back for our 1-minute clinical insight segment. Today we are going to be discussing turmeric and joint pain.
Well, turmeric is a phenomenal anti-inflammatory. So if you're suffering from joint pain, say like osteoarthritis or even rheumatoid arthritis, muscle soreness, we use turmeric a lot with patients. Not only do we see it work well with patients, but there's very good studies showing that the curcuminoids, these active components in turmeric, are really great in reducing pain and inflammation. Now you can use it as a spice, but if you need a stronger effect, we use very well-absorbed supplements to help patients even further.
Turmeric, as well as things for digestion issues like Dr. Mark was talking about, as well as allergies, it's very important. We do use it a lot with our post-COVID situations, with the body aches that people are feeling, with joint pain, also with just the common flu. It's also helpful for decreasing that inflammation.